that were posted online. You can have you can attend this video and have your doubts solved, right? So we'll start with the first question. The question is, which of the following drugs is not used in juvenile myoclonic epilepsy? As you know, JME is basically known as the Jan's syndrome. It is known as the Jan's syndrome. What is important in JME is that seizures occur after getting up in the morning. After getting up in the morning. And it can have multiple seizure type, which includes myoclonic as well as GTCS. Myoclonic as well as GTCS. But what is important here is you should use of avoid use of drugs that cause sodium channel blockage. That cause sodium channel blockage. So among the drugs that cause sodium channel blockage is carbamazepine. So these drugs frequently exacerbate JME. These drugs frequently exacerbate JME, right? They will increase the myoclonus. In the same breath, I would like to tell you, if you are asked which drug is not used in PME, that is progressive myoclonic epilepsy, answer would be same, the sodium channel blockers. Answer would be changed, same, that is the sodium channel blockers, right? So moving over to the next question, you are asked that a 15-year-old boy is on treatment with a combination of valproate and phenytoin. Now, they are asking you all the following adverse effects can be attributed to valproate. All the following adverse effects can be attributed to valproate except. So let's discuss what are the adverse effects of valproate. Number one, it can cause weight gain. It can cause tremor. It can cause liver failure. It can cause hyperammonia. And it can cause neural tube defects. So let's just see whatever we have read about the side effects of valproate do we get here. Weight gain, yes, it can be attributed to valproate. Elevation of LFT, yes, we can attribute. Rise in serum ammonia level, yes. But what about lymphadenopathy? Lymphadenopathy is seen with phenytoin. Lymphadenopathy is seen with phenytoin. Now with phenytoin, we can have lot of symptoms like ataxia. They can come with acute phenytoin toxicity where there is ataxia, nystagmus. They can have hirsutism. They can have gum hypertrophy. They can have hypocalcemia. They can have lymphadenopathy. Okay, they can have lymphadenopathy. So your answer to this question is basically lymphadenopathy. Next question is, a 32-year-old male complains of falling asleep at work. So the patient is falling asleep at work. Second, he attributes to disturbed sleep at night. Okay. He also gives history of falls while partying with friends. So if you have a history of fall, if you have a history of fall along with sleep disturbance, along with history of sleep disturbance, first let us analyze falls. Falls can be seen in myoclonus or narcolepsy or narcolepsy. With myoclonus, usually what we see in conditions like GME, that myoclonus increases with sleep deprivation. It increases with sleep deprivation. It increases with sleep deprivation. But here we are giving